Welcome to today's eLotus webinar, your leading source for acupuncture continuing education. I'll be your host, Donna Chow. Today's webinar is Master Tung Acupuncture, Functional Clinical Applications, Part 1, and is sponsored by Evergreen Herbs and presented by Dr. Robert Chu. We will be hosting Part 2 tomorrow, so we hope that you can join us then as well. Today's webinar will run from 8 to 5 p.m. Pacific time with 4 breaks, and lunch is going to be from 12 to 1 p.m. Before we get started, let's ensure an interactive session by everyone. If you can go ahead and do this now, set your chat preference to everyone. If you have any questions for our instructor, please type that into the Q&A box. Our instructor today is Dr. Robert Chu, a licensed acupuncturist and herbalist specializing in the Master Tung Acupuncture methods. In his private practice in Los Angeles, he effectively treats patients with pain, a wide variety of internal diseases, gynecological disorders, infertility, and side effects from cancer treatments. All right, let's get to the good part, everyone. Let's welcome Dr. Chu. And Dr. Chu, please feel free to take over.
Thank you. Thank you so much, Donna. Thank you. Good morning. Sam and I were having a long day yesterday, a very long day. I've been very busy with the clinic and out-of-town guests and teaching martial arts and all that stuff. So the lecture notes are on its way, I promise. But yeah, I mean, you follow along anyway, and you'll catch up. And it's mostly, don't worry. I share with you the slides and everything. So this is your seminar, your webinar, and I want you to be as interactive as possible, especially when I'm going to be talking about Master Tung's use of regular acupuncture points. And as we go through it together, we'll have a lot of growth and understanding of the Master Tung system. So I'm very excited to share this with you. I've been contemplating this a long time. Of course, when comedians, they don't want to follow a comedian who's funnier than them, and then they fall flat on their face. So I have to honestly say, my colleague Henry McCann did a fantastic presentation in December. So it's like, I got to do one in January. I got to follow the great Dr. Henry McCann. So I wanted to make sure I did my best too and put my best foot forward. And I very much enjoy Henry's talk last month. And you guys, I hope you'll enjoy my talk, because it's a very sincere, from the heart lecture that I'll be doing today. And basically what I want to do is share my journey in Master Tung and help you understand, so that on Monday you'll be using the Master Tung system. And in using the Master Tung system, you'll be saying, oh, okay, this is what Dr. Chu meant. And this is, I could use this and this and this. At any rate, this weekend will increase your overall acupuncture ability to a much higher level. And some of the stuff I do is, going to explain the Master Tung system from a person who's been practicing it for 20 plus years. So definitely it is a great thing to be able to share with all of you. Thank you. Okay, so let me share the screen here and get into the webinar, and let's do that. Can everyone see my screen? Hope so. Yes. Okay, I am sharing.
Yeah, we see it now.
Excellent.
Go ahead and share that.
Very good. Very good. Excellent. And here we go. So, slideshow. All right. Good. This. Okay. So, please excuse any gender pronouns. Especially for an audience this size. I'll just stick with the traditional ones. If we want to, we could speak Mandarin or Cantonese, and then Chinese really has no gender pronouns. It's the first very gender, no gender bias language. We will go on a journey using the works of past masters so that we can really understand the Master Tung system, use logic and reasoning to see the choice of point selection. And what I mean by this is actually the point selection as it pertains to, how can we say, regular acupuncture points. So you'll give a lot of thought to it. I'll give you many beginning systems to start with. And then to get the best results, try needling yourselves. Tomorrow we're going to have a actual show and tell session where I do demonstration of needling so that you'll get an idea of it. Of course, you know, it's not the same as being live in person where you can actually physically talk and palpate and things like that. But you'll try it on Monday when you get back to the clinic. Try to use the concepts and principles I taught this weekend in your clinic immediately, and you'll see it's a different thought. And I'd like to also share my journey when I was an acupuncture student at Samurai University, about close to 30 years ago. Samurai University was the first Chinese medicine school of its time in Southern California. Unfortunately, through change of management and other factors, the school closed. But myself and Lorraine Wilcox and other alumni graduated from Samurai because I was in the English language program over there, and Samurai had both Korean and Chinese as well. I would often sit at lunchtime in the clinic with the fellow Chinese students. And one day I saw some of them reading the book on Master Tung. It was Dr. Yang's book. And it piqued my interest because this book really spoke to me. And although it was only in Chinese at the time, you know, it seemed very deep and seemingly very mysterious. I said, oh, I really want to study this. So I got a book of my own. And it was something that really intrigued me and caused me to pursue it. So we're going to look at some of the older literature and works available on Dong's Acupuncture. We're going to use the common points that you learned in TCM school, but look at it from a different light. And with this weekend, you'll be able to instantly treat pain with experienced points. And I'll tell you my best practices and my opinions, you know, as it is. And then acupuncture itself is an art form that you can use for self-development and spiritual cultivation. And I am very proficient for eLotus, this type of talk. I'm very used to using Zoom, and so you know, I'm used to using chats and question and answers. So you'll be able to do that. I see Danelle, yes, my classmate, and so I'm very happy to see some of you guys. So very good. And if you have questions and answers, you know, we'll answer them. Right now, I do want to say there's a question about where are the notes. The notes are forthcoming. They're going to be just uploaded as well as the quizzes to the site. So you'll go back to them. But for the time being, you know, I mean, you could just hang with me, and I promise I'll talk through my slides because that's the whole idea behind this. Okay. So thank you. Let me see what else is here. I'd like to start off my my talk with a little bit of a Zen story. One day, a philosophy professor went to see a Zen master, and they discussed similar items between Zen and philosophy. And the Zen master finally stopped talking and started to pour tea into the cup. And he kept pouring until the cup was overflowing. And the professor could stand it no longer and said, enough, it's full. So the master said to the professor, you're like this cup full of your own thoughts and ideas. If you don't first empty yourself, how can you taste my tea? So I want you to maybe forget some of the things that you've learned in the past. And in forgetting some of the things in the past, maybe come back to it after you've heard my perspective so that it can help you. And I think today and tomorrow will be very enlightening to you, I promise. Okay, so thank you so much. And let's take a look here. For us Chinese, we always think that we stand on the shoulders of giants, and we have a famous saying, 饮水思源. When you drink water, remember the source. I don't say I made up this stuff myself. If it wasn't for my teachers, if it wasn't for Master Dong, I would not have the opportunity to present this and then share my perspective. And so that's the best I can do for you. And so we would like to always remember where we come from, in TCM schools, because TCM schools can be how can we say, a little bit distant as opposed to the teacher and student relationship, personal one-on-one. Then I think what's very good is in seeing this, you'll see that sometimes if you're on a path, you need people to point the way for you. And in pointing the way for you, then you'll know very clearly what this will do. Okay, so this is Master Tung. Master Tung was a revered acupuncturist in Taiwan. He was an inheritor and innovator. In 1949, he came to Taiwan from China because of China was involved in a civil war between the CCP, the Communist Party, and the Nationalist Party. The Nationalist Party lost, and they were deposed to Taiwan. And remaining nationalists in China were either jailed or reformed, and had to go on from there. But Master Tung was so well trained that even though the Dong family notes were destroyed during the war, what had happened was he was able to recreate the system in his mind and really develop it and disseminate it. And he did not make it a requirement to pass it on only to those with the surname of Dong. Okay. So regarding Master Dong's name, this is the Wade Giles spelling of it, the legal spelling of it from Taiwan. Of course, if we were to spell it in Pinyin, we would spell it Dong, D-O-N-G, Dong's Acupuncture. Don't call it Master Tung's Acupuncture, or worse, Master Tung's Acupuncture. And then his name was Jing Chang, not Ching Chang, which sounds horrible in English. So, I do want to clarify, Dong Jing Chang was his name. Master Dong is how we refer to him today. Yeah. All right. And in my talks, again, nothing happens in a vacuum. I'm so glad that I've had so many good teachers, particularly Yang Weijie, who was Master Dong's disciple, and he was instrumental in my learning the Master Dong system, first through his work and then personally from him directly. And then I also served very briefly as his translator and coordinator of his seminars. Dr. Wang Chanmin, I met him at Dr. Yang's seminars, and he's the junior of Dr. Yang, but he's also a master in his own right. And I thank him for answering my questions about the Dong system, getting his perspective, and then having some deep conversations with him also about looking at the Dong's older literature. He gave me some great insights into the older literature from the Chinese. I never met her personally. She was alive when I was studying Master Dong's, but unfortunately she suffered a big stroke. Miriam Lee. She's the pioneer of Dong's acupuncture in the United States, but she's also a pioneer of acupuncture in California and the United States, and a great woman, acupuncturist. She passed away recently, and most of her teachings came to me through her student, Esther Su, who started me along the way when I attended a lecture that Esther gave at the CSOMA way back, and really helped me solidify my understanding of Master Dong. Esther Su generously shared her notes on Miriam's teachings, her lectures, the different systems that she studied, and then her great 10 points, which I'll speak about today as well. And I'd also like to thank my students in the spread and development of ITARA, the International Dong's Acupuncture Research Association, of which I could never do without you. You know who you are. You've helped me along the way, and all your time was very valuable, and I'm quite grateful for everything. Please, the information, please don't distribute it. It's only for you who have attended the class. So really, it's just something that, I hope that you'll keep for yourself and treasure and learn. My secret is, I think, for an acupuncturist, is that they're able to listen, explore, translate, and interpret a patient's signs and symptoms from contemporary language into the language of acupuncture and TCM. And then from here, the treatment and herbal therapy all spring forth. And so what I mean by that is, someone comes to you, they say, oh, my neck hurts here. Okay, well, we have to know where specifically, what vertebrae, what channel, how does it translate to TCM? What is the condition? Is it chi and blood stasis? Okay, if that's the case, then why is it? Is it because of wind, cold, damp? Is it because of trauma, local chi and blood stagnation? Or what is the cause of it? So that's what I'm saying. And all the while, we can have a straight face and still talk to the patient and not have to go into TCM jargon, but just fluidly speak to them, of course, in English or whatever language you're speaking. And then understanding the methodology of acupuncture and Chinese medicine directly. So I'm seeing some more questions here. Okay, so I'm gonna answer the question live again about the notes. The notes are forthcoming. I promise they'll be there. Sam can give a better idea as to when, and I'm sure that will happen soon. But don't worry, okay? The notes are forthcoming. All right. We had a late night last night. Okay, and let's see, anything in chat? Okay. All right, excellent. So, all right, thank you very much. Chady, hi, how are you? And thank you very much. Yes, Samra, way to go. Yeah, Samra. All right, let's go forward. So a lot of these are on the eLotus website, and I wanted to really up my game after seeing Henry's lecture in December. So because of that, I re-looked at my slides and then started to update some of them. About Master Tung, he saw about 40 patients a day. Now, some people have somewhat embellished some of that story, said that he saw 100 patients a day. People would line up around the block to see him, things like that. Maybe for Star Wars, maybe for a big movie or something like that. But, I'm glad to hear it's realistic, like 40 patients a day. I was always thinking and beating myself up. How come I can never see, 100 patients a day? I think the most I've ever seen, maybe at a seminar, is probably treating about 52 patients at one day seminar, like in Europe. So, that was kind of crazy, but I did it. But I also had assistants and I had interpreters and other things like that. So maybe 52. So that's pretty tiring. And even on my best days, maybe I've seen 20, maybe 30 patients, but 40 is possibly doable and, it's more realistic. Master Dong was recognized in Taiwan as a representative of fine people and fine deeds because allegedly he treated about a quarter of the patients at no charge, especially in the military. And it was well documented where he went to Cambodia and treated President Long No from 1971 to 1974. And, his treatment was discussed and talked about with Dr. Wong's discussions on eLotus as well. So you can refer to Dr. Wong's lectures on eLotus and then see what you see there. On Taiwan, Chiang Kai-shek offered him an honor certificate in the field of traditional Chinese medicine. Now, this was very interesting because Chiang Kai-shek, the first president in Taiwan, gave him an honor certificate in the field of traditional Chinese medicine. But notice the T is a little t and not the big T like TCM. Now, TCM was was created in China after 1949, more likely the early 1950s to mid 1950s, and still developed from there. So technically speaking, the Dong system is older than TCM. Now, if you're saying that TCM is from the classics, I would have to disagree with you, and we'll explain and understand why I'm saying it from my point of view. Okay. All right, so I'm seeing more questions and more chat here. Okay, very good, Jonathan. Thank you so much for sharing that with us. And again, the notes, the notes, I think that'll be the thorn in my side this morning. Okay, so I'm not going to answer anymore. The notes are coming. All right. Master Tung teaching style, and this is E. Lotus had an interview with Dr. Wang Chunmin and talked about it. And some of the questions were very, very good. And I wanted to highlight them here so that you can have a good feel for who Master Tung was. Only a few students could accompany Master Tung in the treatment room. Afterwards, others could see where he needled, then ask the patient questions. So, for example, maybe 2 or 3 could go to the treatment room when Master Tung was seeing a patient. And then the patient, let's say, some lung issues, okay? So as they had lung issues, Master Tung proceeded to needle sima on the thighs. There's 3 points on the thighs, and we'll discuss the location and the points later. And then he would needle and leave. And he was not really a talkative fellow. He would just pretty much needle and then leave. So then other students who were his interns, they could go into the room and then maybe ask the patient, hey, why are you here for? What are you doing? What's going on? How do you feel right now? So 3-month interns could ask Master Tung questions directly. To ask a question, the student had to knock on Master Tung's office door. And if the question was too simple or not thought through, he would send the students away and ask them to find the answers themselves, or they got it from their seniors, or they got an answer after thinking and contemplating, oh my gosh, that was a pretty dumb question. So maybe I should really think that through. I think that more traditional Chinese Confucius way. I know, like my own Wing Chun Sifu, he was very old-fashioned, hardly ever talked. If I asked him a question, I could sit in the office with him. But sometimes, if I had dumb questions, he wouldn't say anything. He'd just smile at me. And or he would just say a few words, and then I would have to contemplate them, right? And then do that. So it's a very common Chinese way of teaching. Students were allowed to needle after following Master Tung for 1 year. Prior to needling patients, Master Tung required his students to needle themselves first, so they knew how the points felt. So that's why I asked you to also needle yourself, so that you'll have some idea behind all of this and what does it do. And if we pay attention to the needling style, we'll know specifically what are we doing. All right. So this kind of helps us. So my next slide is how many Master Tung points are there? In Dr. Wang's book, Introduction to Tong's Acupuncture, there's about 213 points. And if we include the trunk points, then there's about 680. And the 680 points is unique. I never counted all of Master Tong's. I've tried counting it on many ways. So others have more, and they say 740 points. I still don't know. Okay, maybe some of you guys want to break it all down and take a look-see and how much everything would do. Nancy asked a question about 4 horses. It's not really called 4 horses. In Chinese, we call sima. Sima means chariot horses. Okay, it's not 4 horses. It's a very poor translation to just simply call it 4 horses. In the old days, if you had a fast chariot, you had 4 horses on it. But it's the chariot horses which makes things fast. Okay, so notes are coming, and Lilani Sima, the first character we'll see later on, it has horses and 4, and then wheels or carriage. So it does not mean 4 horses literally. That's an oversimplification, shall we say. Okay. And so I want to correct that. And being bilingual has had many advantages for me because it helps me see the Master Dong system and how, well, maybe early writers, early authors of Master Dong were a little bit, how can we say, oversimplified, or perhaps didn't quite give the picture, or maybe wanted to keep their secrets close to the vest, or some other reasons why they weren't clear with the Master Dong system. Also, maybe the Chinese way of teaching is not always 100% clear to everybody, so everyone has a different idea. Okay, so why do Master Dong points vary? And Dr. Wang continues, Dong point locations are not exact points as they are described in point location books. Rather, as a point location refers to a general acupuncture area in which there's a center that is most reactive. For every point, the exact location of the center is different for everyone. Therefore, Master Dong will palpate for the most tender spot in this acupuncture area on the patient, or palpate for any anatomical structure changes to determine the exact point to needle. By palpating first and needling the most tender or reactive center of the acupuncture area is the most effective method. Now, I want to tell you about my ear acupuncture mentor, Dr. Jacques Marco. He's currently the Dean of Emperor's College in, well, now it's Culver City or Los Angeles, you could say. And when I was a student, and we've been longtime good friends for over 30 years, he said to me, you see the ear acupuncture chart, that just kind of represents where the points are. The points are not exactly there. Okay, so what you have to do is look at the points, and then with a probe, you need to look at where the point is. Now, a probe is a very small thing. You know, your finger is not as is much bigger than this probe. Okay, and it's not as sensitive. So you have to learn, and you have to get feedback from the patient when you're pressing the ear acupuncture, quote unquote, point. It may not be exactly what you're looking for, so you have to determine it from palpation. The same thing with body acupuncture is the same thing. So even though we have a point chart location and we have an idea, it's not always exactly the same. So I want to stress and emphasize that you know, palpation is very important in dongs. And I often tell my students, don't palpate with your fingertip, okay, thumb tip, fingertip. I want you to palpate with your fingernail. And if you palpate with your fingernail, you'll have a better idea as to what the structure is and how to feel it. I have several talks about this. Does anyone know what I always say? I always say, I have a saying, use your nail and you won't fail, or use your nail and you shall prevail, or, you know, use your nail and you can't fail. Okay, so this way you know the importance of using your nail, because if you use your nail, you'll be able to palpate the point, and then you'll see the most reactive or most tender Asher confirmation, you know. And Asher, as I've said, is the same thing as in English. It's just that, you know, if you're speaking Northern Mandarin, you pronounce the R as Asher, right? But in let's say Taiwanese Mandarin, or just Southern style Mandarin, then you say Ashi, right? And it's the same thing as in English, but we just don't pronounce the T. So you'll get the idea, okay? And so as long as you understand palpation is very important, then you'll know specifically, oh, you have to look for it. And in some ways, the Japanese also already maintain that. They call it kori point. The point is alive, okay? And it's true, because you're a living human being, the points are always alive. So I want you to understand that. Okay, very good. Yes, Oscar, we share the same colleague and friend, very close. Okay, why do Master Dong points vary? Okay, so Out of 72, 73 disciples of Master Dong, only a handful were already acupuncturists. Only a handful were medical doctors or had some training or were acupuncture students or chiropractic students. Only a handful. The rest were laymen. So even though they had studied acupuncture in the traditional way with Master Dong, maybe they are not so astute in their point location. So, but Dr. Wang says it in a very politically correct manner. Master Dong students have seen him needle slightly different locations for the same point, and why there are discrepancies on location descriptions of some points. This is why there's discrepancies. And this is also the same reason there's additional points to Master Dong's original ones. Some of his students gave these new points different names. In other words, they made up stuff. Okay. And so, day 2 of Henry's last lecture showed some of the newer made up point prescriptions. And not to say they're not effective, they can be very effective. But the thing is that they're very different than what they usually are from the original few Master Dong points. Or there's a lot of Master Dong points, but not. But that's why there's variation. So everyone has a different point of view. And they're all very valuable because we're getting to see from the last 70 years or so, 73 years, 74 years, publications on Master Dong and how they grow and change. And you're able to understand why this is the case. So moving forward. Okay. Did Master Dong feel there's a maximum number of needles one should not exceed? Okay, and I'm guilty of it. Yes, use between 6 to 8 needles, no more than that. And you'll see sometimes my point prescription is 10 points. Sometimes it's 8 points. Sometimes it's 12 or 20 points when you're starting out. You don't know how to eliminate them, or you don't know how to optimize your choices of needling. And so you'll make that mistake. And it will be like you're making your patient into what is a pincushion, or maybe a voodoo doll or something of that sort, or porcupine, whatever you want to do and say. But the next statement is very enlightening. He goes, let's remember Master Dong used 26 to 30 gauge needles, but mostly 26 gauge. Because Master Dong used such thick needles, strong stimulation was elicited, and thus 6 to 8 needles were sufficient. Now, I recently did the first lecture in Chicago regarding Dong's acupuncture to, I think it's AAAA, and they had one Korean gentleman who did research on Master Dong's acupuncture, and his research showed that if you use thinner gauge needles, you'll probably need more thinner gauge needles to get an effect. If you use a 26 gauge needle, i.e. like a knitting needle, sticking into, GB31, for example, you'll feel that right away, versus a 38 gauge needle, which is, infinitely smaller than that. So I want you to know, the thicker your needle, yeah, you could do it freehand. And the thinner your needle, you'll need a guide tube, but you may need more needles. So, and then a lot of the needles are assist needles or groupings of needles. So you might want to enhance an effect so that the body gets the stimulus. Let's think of it as acupuncture is a targeting system. And I'll speak more about it in a little bit when you start understanding what it's all about, okay, from that point of view. More needles may be needed to produce the same result if one is using a thinner gauge. As for length, Master Dong used needles up to 3 chun. He would leave the needles in for 40 to 45 minutes. And I will be discussing the length of needle retention that you'll need. So this class, although you consider it basic, and eLotus has a way of saying basic class, intermediate class, advanced class, I always like to say it like this. Basics are already advanced. Advanced is just simply the basics applied. And if that's the case, then I would like to say to you that, well, you think it's just basic. but a lot of thought and a lot of time and a lot of perfecting it and practicing it in the clinic is behind it. And so if you say that and you factor in, my length of time in the Master Dong system and other people's length of time, studying it and then writing it down and putting it in a book, then hey, those basics are very solid, and you can't have a better foundation than without basics. Okay, so I want you to say and understand basics are really, really important. And 40-minute needle retention is really not necessary. And we'll discuss that in depth tomorrow or maybe later today. So anyway, Master Dong used traditional points. Yes, all the time. Yes, he did. And the point he used the most was Ne Guan, pericardium 6. Now, I won't compare myself to Master Dong, but I do use regular acupuncture points all the time. And in fact, when I write on my soap notes, I may not always write the name of the traditional point in Master Dong nomenclature, especially if other people are going to read it. What I'm going to do is I'm going to give the information as to, let's say, a standard TCM location. And we're going to uncover and unravel how Master Dong used regular acupuncture points and what was he really getting at and underneath it all. Okay. Did Master Dong bleed all his patients? Did he bleed before needling, or did he needle first, then bleed? So we're talking about bloodletting or pricking. In California here, I want to say, don't ask, don't tell. That's the way the acupuncture board has, as I understand it, is going. So we don't actively prick in California by law. Okay. Master Dong pricked most of his patients. He would then bleed them first and then needle the appropriate area using Dalma. Okay, but Dr. Yang writes, bloodletting therapy is more effective if distal points are chosen. This conforms to the old saying of pricking distal points. The foot is pricked to treat diseases of the head. Similarly, diseases of the lower part of the body is treated by pricking the upper part of the body. And to treat diseases of the lower limb, the back is pricked. And this was a statement by Dr. Yang in his book, A Study on Dong's Acupuncture. Okay, so this way, I want you to understand, pricking is very good. Me, because I look at acupuncture as the loss leader to bring in patients, and then maybe the real healing begins with herbal formulas, especially custom herbal formulas, and then maybe pricking. I needle people first, and then I prick them. For example, I have a patient who came in for gout, and he has gout in his big toe, his right side big toe, and he has ankle pain as well because of gout. So I'll needle the right side to treat the left and the left side to treat the right. But let's say I'll use my foot 5 tigers for his right toe and maybe spleen 3 on the opposite side on the left foot. And on the right side, because his left ankle's hurt, then I'll needle GB40, GB41, 43 to help. But as far as pricking, I prick after I retain the needles for a period of time and then just prick him on certain areas. And the pricking areas are typically, I prick Shishuan quite a bit, and the equivalent on the feet. Shishuan is the fingertip points or the toe tip points. Okay. And so I use those more than I use the regular Dong's points. But then at times I do prick Dong's points for fun. So as I said, in California, don't ask, don't tell. Okay. So don't be too excited about pricking. But if you're going to prick, then make sure you prick and you better wipe it up. Okay. You got the idea. Okay. Local Ashu needling versus distal needling, which is more effective? So Dr. Wang continues, local Ashu points are good for acute conditions, but not for chronic conditions. So overall, distal points are preferred. So we'll discuss that a little bit more, but it's a good idea to get it from a student of Master Dong so you understand what is he saying and why is he saying it. Okay. In treating chronic pain, do you needle the healthy side or the disease sides? Now, yeah, both sides would work, but needling the healthy side will produce better results because the nerves are undamaged and can better transmit the signals to repair the diseased area. On the other hand, nerves on the disease side are damaged or blocked. So stimulation on this side won't produce as good as a result. And I agree 100% with that. If a person has had a stroke, okay, you're going to needle the opposite side, the healthy side. If they have a stroke on their right side, you're going to needle the left side. For example, I shared with you in my previous lecture how during about 2 years ago, I had the Bell's palsy on my face, the right side of my face. My eye couldn't close. My mouth was awry. I had terrible pain behind the ear and on the right side of my face. I needle mostly the left side of my face, and it's all documented and shown. And I needle the left side of my body more than I needle the right. But for the right, I did do a few points to stimulate the area and bring it back to normal, right? I didn't want to look like, Two-Face or Quasimodo or anything like that with the crooked face. So I wanted to balance it out. But I got first a result of needling the healthy side. Then I would stimulate and move or massage or wasa or use a jade roller or something to stimulate the blood flow here. And then I would needle the actual location here and get a more balanced, healthier effect on both sides. Okay, why did Master Dong needle close to the bone? And especially you'll notice when you're doing Sha San Huang points, you needle close to the bone. Now, according to Dr. Wang, Master Dong never explained why, but according to Dr. Yang Weijie, he believed it was because it produced better clinical results. I don't 100% agree. My take is that it's safer, and you have more border and understand it. Most beginning Dong students, when they try to needle the spleen channel, they needle the spleen channel actually 1 finger breadth too medial to where it should be. It should be right against the bone, and that is a better way of saying things, So I would have to say I don't agree 100% with not needling against the bone. I think you should, and we'll see today why. Now, in terms of, let's say, stomach 36 and 37, many acupuncturists needle 1 finger breadth away from the bone. That's because in the old days, they were using very thick gauge needles, and infection to the periosteum of the bone, let's say the tibia, would be possible. And then maybe these were done by less skillful people like the barefoot doctor paramedics who, they're paramedics. Come on, they're not skilled acupuncturists. And as a result of it, they could needle you and then cause infections, especially with big gauge needles or not autoclaving the tools properly or anything like that. That was before disposable needles were common. Nowadays, everyone has disposable needles, so not such a big deal. But, you just have to know exactly how that is. Okay, so there we go. Donna says the handout is now ready. So all of you are going to go run in and get all of your downloads and enjoy it that way. So glad. Thank you so much, Donna. All right. What are some needling tips from Master Dong for better clinical results? When needling the muscle, when treating the muscle, needle the muscle. When treating the tendon, needle the tendon. When treating the bone, needle should touch the bone. Okay, so then that is very good because the Master Dong is using the tissues to stimulate everything. For example, if you have a hemorrhoid, you want to prick a blood vessel so that you can remove the hemorrhoid. Okay, if you have muscle soreness, needle into the depth of the muscles. When you have tendon soreness, for example, let's say you have elbow pain, tendonitis from doing too many curls, well, then what you do is you simply needle the tendon. So let's say you chose GB34 for treating the tendons. You want to needle right into the tendon of GB34, as is the influential point of the tendons. And so that's very, very, very important, okay? And so on and so forth. Needle the bone to treat the bone, etc. So Master Dong also suggested for conditions on the left side of the body, needle the right side, and then vice versa. So pretty much what we'll be discussing. And then for conditions on the upper part of the body, then needle the lower part of the body. Okay. All right, so fantastic. I'm glad everyone is having a good time downloading the notes. Does depth of needling matter? Yes, most definitely. Generally speaking, superficial needling treats diseases in the local area or disorders of that same channel. Deeper needling treats conditions that are more distal or deeper inside. So one of the best examples is Master Dong would needle stomach 36. If he needled 1 to 1.5 Chun, it would treat digestive problems or pain of the leg problems, while needling 3 Chun or deeper treated respiratory and or cardiovascular disorders. So that's a good way to look at how Master Dong needled. So the deeper is the more distal, the more shallow is the more local. So you have an understanding of what that is all about, okay? So on Taiwan now, this was in the Facebook forums. You know, we're all friends there, and so I'm sharing this conversation that happened only a few weeks ago. And Tina was visiting Taiwan, so Cole asked Tina, "Are you seeing anyone do Dong's points?" And Tina replied, "So ironic that Dong's acupuncture is from Taiwan, but nobody I have visited so far is using it." So Dr. Wang chimed in. He said, "Because the Taiwan government does not officially recognize Dong's acupuncture. If you use Dong's acupuncture points, you won't be covered by universal insurance." So it's not unusual that, let's say, a Dong practitioner such as myself, if I was needling Ca San Li and Ca Xia San Li, which is on the stomach channel between stomach and gallbladder, and I might write on the chart it's stomach 36 and 37 as opposed to Ca San Li and Ca Xia San Li. Similarly, if it's on the sole of the foot and I use the point Shang Liu, upper tumor, then I might just write kidney 1 on the chart, so that there's no issues regarding insurance or what I'm doing, especially for non-Dong acupuncture trained acupuncturists. So it's just another way of writing it. So I think Dr. Wang continues, if you use Dong's acupuncture points, you can only record traditional acupuncture points in your medical record. And so that's pretty much what is happening. There's a question here from Tamra. Says, if a patient is on blood thinners, would deeper needling still be advised? No, I don't think so. I don't think that would be very wise. So I would just move up the channel closer to where the problem is. Okay. Why isn't it recognized and covered? Because the government only recognizes quote unquote traditional acupuncture points. Maybe there wasn't a strong enough or big enough lobby of Dong acupuncture practitioners to make it so. And look at this country. We can't even get the acupuncture directly into the healthcare system. I mean, it is, but it's not. You know what I mean, okay? So sadly, that's the case. Okay, so I interjected on this conversation. I said a certain doctor said there was a spleen 9A as a point instead of Shen Guan. Okay, which, spleen 9A, he said it was 2 Chun below spleen 9. And, I recognize it as Shen Guan, even though Shen Guan is supposedly 1.5 Chun below. If you palpate the usher, it might bring you 2 Chun below. So when I practiced in the hospital in the early days, there's little reference to Dong's acupuncture here. So I write liver 2-3 instead of Hou Yin Hou Zu, or I write stomach 36 instead of Si Hua Shang. As soon as there's a proliferation of Dong's acupuncture in English and everyone uses it, then there's a legal precedence for medical malpractice to refer to. Okay, so everything we do let's never forget, soap notes are a legal document, a medical legal document. Myself as a QME, anything I write is legal medical. So because of that, then it's very, very important so that you understand, if we're writing soap notes, that's good enough because, it's good to understand where we're coming from with regards to this. And don't overthink it. Just make it something that, okay, I can understand it. And, I'm doing it for the benefit of my colleagues who may not know Dong's acupuncture. Okay, my own experience through making mistakes in the clinic, then I've grown. And I think that's also with regards to life. In making mistakes in life, I've grown. I had a lot of good teachers who pointed the way. I still have a lot of good teachers who guide me and help me on my daily basis. My focus is on clinical application and getting results. I'm not into titles or names or ranks or all this other stuff. All I care about is between myself and my patient, did I get clinical results? Are they feeling better? In life, it's important to break down things into principles. With these, then it comes to the essence. And so when it comes to the essence, you can transmute it and transform it into something bigger. It can go from big picture to small picture. Then small picture can expand to big picture again. It's the proliferation, just like in Chinese philosophy, we have Wu Ji, nothingness, that breaks to Tai Ji, everything. Back down to Wu Ji again. It goes back to nothingness. Our own lives. This is the Taiji of our lives. Okay, but we started out at Wu Ji, almost nothing. Then we came to Taiji, which is everything, and then we go back to Wu Ji, which we came from the source, and that's where we are. So, it's the same idea. And in application, is more important than decorum. Okay, I like to say application is let application be your guide. Okay, application is more important than form and decorum and or other things. Just come down to the essence of things. And regardless of what arts you study, you have a fixed phase and a live phase, and then a changing phase. I borrow this concept from Bagua or I Ching. Where people learn the I Ching, they learn only the Bagua first, and then they get a little bit fixed on it. And then they start to understand that the Bagua themselves are a series of correspondences. And then they become more lively with the changes. And when they create the hexagrams, they're able to understand what the inner and outer hexagrams are, what the hidden hexagrams are, and so on. And then you can understand the readings that you get. And then these change line by line. Okay, so each line of the hexagram, the yao lines, can be changed. I'm only in my early 60s now. Confucius wished and lamented that he wished he had 70 more years of studying the I Ching. I've been studying I Ching for a very long time, and of course, my teacher, Dr. Chen Zhao, the creator of I Ching acupuncture, the I Ching acupuncture balance method, was the one who taught me. And then he told me, you got some homework, Robert, and your homework is really study the I Ching. I said, oh, that's it? Thank you, Master. And you don't know what kind of homework that is. I'm still going. Maybe when I'm in my 70s, Donna, Tina, if we're all still here and, we're not in civil war or, World War, I can come back and do finally something on the I Ching acupuncture. And let's see where we're going with that. Huh? So I'm still doing my homework on that. Okay. My emphasis is on classical acupuncture these days. I hardly do TCM. When I say hardly do TCM, I don't do the herbalized medicine that acupuncture is when it's being taught in the master's program at many acupuncture colleges, or the way that it's being taught in China as is practiced. I like to do classical acupuncture, which is 5 elements, 8 extra, the yuan, xi, luo points, the chrono acupuncture. I practice the I Ching acupuncture created by Chen Zhao, And then I do Dong's acupuncture that I study from Dr. Yang and Dr. Wang, as well as other sources that I've studied deeply from other books in China. So very good to constantly grow to it all. Okay. All right. So the Great Compendium of Acupuncture and Moxibustion, 针灸大成, Yang Jizhou said, get the point wrong is preferable to getting the channel wrong. So very, very good statement. And many people will always say, is it right? Is it right? Is it right? Is my point location right? And, being a hands-on teacher and teaching at the acupuncture school, I get some of the A-type students, the OCD type students, who are really so afraid that they got the point wrong, and they're just dying for me to give them confirmation they did it right. But really, the whole idea is by the end of today, learning that palpation is really the secret to finding the acupuncture points. And it's like following a map. In the old days, we didn't have GPS. We had a map that we had to look, and let's say we wanted to drive from Virginia to California, we'd have to look at a map. We weren't told, or there wasn't a GPS. We couldn't use our cell phones back then, get Google driving instructions or anything of that sort. Okay, we would have to figure it out, map it out, and stop along the way. And then we know that the map is not the territory, because you can look at the map. When I look at the let's say I want to go to a particular restaurant or locale that I've never been in, I turn on the GPS, and in turning on the GPS, I know, hey, this doesn't look exactly like what I'm seeing here. It's a representation. So it's the same thing with the acupuncture points. A point is not really a point. Minerva, sorry, we started at 8 o'clock, and tomorrow it's at 8 o'clock also. So sorry about that. Okay, so here's a little cartoon to help you. And I have a lot of these interspersed in the lecture because I want to clean your palate, refresh your mind, perhaps give you a cracker in between sipping wines and tasting wines, So here's a story about the ordinary mind. A student came to the master and said, how should I practice the Tao? And the master said, eat when you're hungry, sleep when you're tired. And the student said, he's probably thinking, big deal. Everybody knows that. Isn't that what most people do anyway? He goes, no, the master said, it's not what most people do. Most people entertain 1,000 desires while they eat and 1,000 knots while they sleep. And so because of that, their minds are filled, and their stomachs are preoccupied because too many thoughts in the mind. So sometimes it's good to just take a break with the mind and then go on from there. And we're scheduled for a break very soon. All right. So I want you to know, even though I practiced and studied Dong system for quite a while before I graduated from Samra University, before I was able to put it in the clinic, I was still contemplating it, and it reminded me of this story. A youth went to the mountain to look for a famous swordsman to learn swordsmanship. He finally found the master. He said, Master, if I practiced diligently, how long would it take me to master the art of swordsmanship? And the master said, perhaps 10 years. Because my father's getting old and I have to take care of him. If I work far more intensely, how long would it take me? He goes, well, in that case, the master said, it'd probably take you 30 years. And he said, what? You first mentioned 10 years, then you said 30 years. I don't mind undergoing whatever hardships. I must learn within the shortest time possible. Then the master said to him, then you would require 70 years to master it. So those who are eager for so many results, okay, they wind up not achieving anything because they're in a rush. So even if you do something today where you just learn a little bit and then just start applying that little bit, it would be very, very good. And that's what I do with my martial arts. For example, In Wing Chun, we have the straight punch. Okay, you've probably seen this in the movies. The straight punch, although it's very simple, I just showed you what it is. All of you can mimic me right now and do the same thing. Unless you started practicing and punching a wall bag for about 3 years to 5 years, then you start to understand what Wing Chun is all about. And then when you are practicing with partners and doing that, then you'll be able to see how far have you really gotten. Okay. You see, did I teach you the real thing or not teach you the real thing, right? So it's the same thing with Dong's acupuncture. You might just start out with understanding Yin Hozu, the Master Tung liver 2, liver 3 combination, and Sha San Huang. Those 5 points as your basis. If those are your 5 points basis, and then you treat using the imaging methods and the channel methods and channel interrelationships, then you'll see, oh, maybe Dr. Chu was teaching me something deeper. So I want you to understand it. So, okay. Colette asked an interesting question. Do I stop needling as soon as the pain is gone? Well, that's subjective, and that's between you and your patient. I had a patient the other day who just came for neck and shoulder pain. She was trying to swim and she can't turn her head, and therefore she can't breathe by taking her breath in her freestyle stroke. So as a result of it, she couldn't do that. And I said, okay, let's give you one treatment. The first treatment here, we're going to needle UB60 opposite side and GB39, and then I want you to turn your head. She felt fantastic, but what had happened was she then had to come back the next day for a follow-up treatment, and then she complained about her knee. Now, I only needed those 2 needles, but I still gave her, the lower 3 emperors and Yin Hozu, Master Tung's liver 2, liver 3 points, just to relax her and calm her down. And that's been my practice lately. And, I use that as a basis and then use the treating points, which is UB60 and GB39. And the pain was gone. But the next day when she complained about her knee, on her right knee, I just simply needled her LI11 on the opposite side, threaded to lung 5. And that was that. So I just did the same points that I did the previous day, but then added one. So I don't really need to do that much. Okay. I stop needling as soon as the pain is gone. You could say so, yes, but it depends how much preventive pain you want to do. And remember, a good doctor treats disease before it happens. So I want you to be good doctors too. Okay. So thank you very much, Colette. That's a very good question. Okay. So let's look at some of acupuncture's top points, and then we can understand them. And this is something that maybe you want to have as a rote list. And by rote, I mean, paste it up and put it anywhere, and then you'll get to see it, and then you look at it. And some of this I have added to it, and some of this is just classical acupuncture. For example, for the head and neck area, SI3 is like one of the best points. And for the face and mouth, LI4 is, of course, all the classics say so. Heart and chest, pericardium 6. Okay, and you'll see soon where I'm getting at with using this list of points. Lower abdomen, spleen 6. Okay, lumbus and back, UB40. GB34 for liver and gallbladder. Brain and spinal column, DU26. Neck, this is starting my list, GB39. Teeth, stomach 44. Sorry, I never thought LI4 is great for the teeth. I never get a great response, and I tried it during a root canal where my nerve was exposed and cold 40-degree air was dropping from the air conditioning above my head into the exposed nerve, causing me to quiver and shake and shake with pain. When the air conditioning was removed or the exposed nerve was covered, then I was able to needle. I tried LI4 during the exposed pain, it was not effective at all. But when I went home, I tried LI4 again. LI4 still did not have a great effect. So I went down to stomach 44, which is use the lower to treat the upper. And the effect was immediate. My pain was gone. And some of you will know Master Tung's Menjin point is stomach 43 for the nose. It's like one of the most fantastic points to use. And then kidney 1 is also one of the fantastic points of all acupuncture for resuscitation. And in the old days, kidney 1 was the point for resuscitating people who were drowning victims or people who got kicked in the groin or anything else like that. So very good. And Travis asked the question, do I needle GB39 anterior or posterior to the fibula or the most tender one? Different sources say it could be either. And I've had this conversation before with other acupuncturists and then looked at it. I looked at the original classics. The original classics simply say GB39 is, how can we say, 3 above the lateral malleolus. Okay, it does not say whether it was anterior or posterior to the fibula. I palpated it. As a dome practitioner, I know that palpating GB39 was how can we say GB39 was anterior, and that's my prejudice as a dome practitioner. However, I've also palpated GB39 posterior to the fibula on certain individuals, and they say they are more sensitive there. And so I'll give people a choice, A or B. A might be anterior to the fibula, and B is posterior to the fibula, and then have them answer. Okay, so that's, I hope I've answered your question there, Travis. So I would say the more tender one. However, I would say if you're using, let's say, Sanchong, we say anterior to the fibula as GB39. So the Sanchong points for the neck, I would say consider using GB39 anterior as more effective. However, you could try it and see. And Pamela, sorry about your pain with regard to Zoom. Yeah, that's a pain sometimes. Thank you. Okay. So my points here about this list is that in acupuncture, if you look at the hand, okay, these treat the hand and the face. If you're looking at the wrist area, then that's treating the chest. If you're looking at the abdomen, the lower leg is treating the abdomen. The ankle is treating the lower abdomen. The back of the knee is treating the back. The side of the leg is treating the liver and gallbladder. The DO26 is treating the brain and the spinal column. That kind of makes sense. GB39, the ankle is treating the neck. The teeth are used by stomach 44. The foot is imaging the head. The nose is imaged by stomach 43. Kidney 1 is for resuscitation of the head, restoring a person to consciousness. So I would have to say we already understand imaging as a whole, instinctively through classical acupuncture points. And so we should get this idea in the back of our mind. It's like, well, why did the ancients choose points like this and create points like this? And by having it like that, then that would be a good way of looking at it. Okay. Anyway, the Ling Shu, the first chapter of the Ling Shu. Ling Shu is the needling classic. It talks about he who says it cannot be treated has not mastered the skills. In other words, I often hear, Tung's acupuncture is good for pain, but it's not really good for internal medicine. It's not really good for gynecological issues. It's not really good for dermatological issues. I would have to say, no, I disagree. It should be said that the person who has never treated it, they don't understand it, they don't master it, then they don't know. So I want to say something that one of my colleagues, Dr. Kim, a master of Sasang acupuncture, he's in Northridge area. He mentioned to me that acupuncture contains the heavens and the earth and man in between. It contains the constellations and the stars and the universe. And when you're needling, it's not just needling the body, you're also needling the mind, the emotions, the thoughts, and the spirit. So I want you to know that the healing aspect of being a doctor is very, very important. You cannot think that when you needle, you're not healing anything else, okay? But in this very first step, let's concentrate on pain, and then you'll see the immediate effect, and then you'll see how lofty the healing aspect of being a doctor can be for yourself and for others, okay? And for myself, I've noticed as being in this profession now for 24 years, it's certainly healed myself and helped me grow as an individual. And I'm able to learn, not just physically, but mentally, emotionally, spiritually. Okay. And I see my place in the heavens and earth. Confucius had a saying, at 50, a person knows the will of heaven, right? 天意, right? So if that's the case, then I understand now, our profession is really, you think it's healing, and then it is for healing yourself. Roman asks, what is my definition of the spirit? Okay, the definition of the spirit is, of course, in Chinese medicine, is the shen, but I would have to add, it's the huan, it's the yi, it's the zhi, and it's the po. Okay, so you have everything, every aspect, the 5 aspects of the spirit to ourselves and what we're studying. So it's not just purely Shen, but it's good to understand Shen. Okay. All right. So very good. I think very, very good here. We're moving forward to it. Let's take another minute about this and talk about another chapter, another part of the chapter of the 9 needles and 12 yuan source points. Anyone here read the Ling Shu? You should read it. It should be required reading for needling. Okay. So there's a sentence that says the 12 yuan source points come out of the 4 guan. And I kept thinking, what's the 4 guan? The 4 gates. The 4 guan treat the 5 zang. And it's like, what? 4 zang? The 4 guan, the 4 gates treat the 5 zang? I was thinking Li4 bilaterally and liver 3 bilaterally treat the 5 zang? How can that be? What's going on? And then when the 5 zang are ill, the 5 zang, these are zang fu. So if it means 5 zang, it also means the liu fu, the six bowels. 5 zang, the 5 organs, and the 6 bowels are all treated. Then apply at the 12 yuan source points. And it's like, what? This is all cryptic. I can't understand it all. It's too much. What does this mean? So then when I read another book, there was one sentence in the book, because in those days, only 10% of the population could read Chinese. So you have to reference and cross-reference what other books are saying so that you can understand each other. And then every time there's little insight that helps you, like a detective, to grow better and better and understand it. So the Tai Su said the 4 guan are the 4 limbs. So let's look at it with this understanding. The 12 yuan source points are in the 4 limbs. These 4 limbs can treat the 5 organs and 6 bowels. In other words, all the 12 channels. Okay. All right. And then if that's the case, when all the organs are ill, apply the 12 yuan source points. And the yuan source points don't necessarily mean the 3rd or 4th point, the 3rd point on the yin channels and the 4th point on the yang channels. Don't think that way. It means that the ancient points below the elbows and knees are really the source of treating all diseases. Okay, so very much that's the case. And so although this is quite cryptic, I want you to understand, when you're reading the classics, it's not quite as cut and dry if you don't have a good teacher to help you. All right, and this is something that you need. Okay, I think everyone's been asking about the notes. I think we've answered those questions ad nauseum. So I think it's time to take a break. So it's 9:17 now. Why don't we take a 15-minute break and come back at 9:32 and regroup, and let's come back and move on from here. Okay, I need a little bit of a break, and I think everyone else does too. And please, no more questions after this. Okay, Donna says 9:35. That's great. No more questions after this regarding the notes. Okay, it's there. It's there. Look at it. Okay, download them during the break. See you soon. Thank you.